Dr. Beck, let's talk a little bit about how physical therapy might or might not, might or might not help with overall health. Let's just say there is no major, shoulder which, is kind of hurting or this or that, no major accident you had, but maybe an overall fatigueness is over you. You just don't feel as good as as you want to feel, as you think you should feel. Or what about the illnesses such as the yearly flu season and stuff? A person who is undergoing physical therapist, and then I assume once you have gone to a physical therapist office, there's lots of things you can do at home without having to step into the office, I assume. And anyway, does it help for general health as well rather than for immediate pain?
It can, and being in good shape, healthy physically, and in physically good shape as far as your strength, your endurance, your cardiovascular conditioning, can help with a number of medical conditions. We know blood sugar and problems with diabetes respond very, very well to exercise. High blood pressure responds to exercise. Cholesterol and lipid levels go down. Those are the fats that cause heart attacks. They get better with exercise. There's just a variety of conditions medically that get better when you're fit and in good cardiovascular and good shape overall physically.
Okay. Well, so because basically for all purpose, physical therapy is a form of exercise. It just seems to be, very much, very precise, a particular exercise, a particular movement to help out a particular muscle, and not necessarily to make it super strong to be then a world champion in something, but to make it functional, I suppose. It's when it has failed to function the way it should.
That's correct. Now, when a physical therapist is working with you, she or he is usually focused on one specific body part. Say I have a strained shoulder or a strained back. So their emphasis while you're in treatment will be on improving the flexibility, strength, and conditioning of that body part. But what we do know is that when you have better flexibility and better strength, you are much less likely to have injuries in the future after you undergo the physical therapy. So it's really critical that you continue with the home exercise program and a general exercise program that the therapist will give you when you're in treatment with us.
Okay, wonderful. So basically, do strengthen, your body, and it's in any case, it's very, very precise towards a body part or a couple body parts which are simply not functioning, get them up to par with the other parts. All right?
That's correct.
Yeah. Well, that starts putting a little bit light on physical therapy. I appreciate it.